Good afternoon and welcome to our webinar on Education Interrupted, Stopping the Setback. My name is Lindsay Glasgow and I'm the new President and CEO of Plan International Canada. I actually just joined 6 weeks ago, moving from Geneva, Switzerland, where I was acting as the Secretary General of CARE International. And I've come to Plan having worked at a variety of NGOs, including the International Olympic Committee, Special Olympics Canada, Right to Play, and have spent a number of years working for the UN and the Canadian government, and actually began my career in the business sector. But what really drew me to Plan was, well, there were many things that drew me to Plan, but most importantly, it's really Plan's strong reputation for delivering high quality programming and its deep commitment to children's rights and the equality of girls. And we've all seen in this present day, I should say, that this work has never been more imperative. COVID-19 has caused unprecedented hardship across the globe, and it's really shown us how truly connected we are. In today's interconnected world, it has also demonstrated, unfortunately, that crises are not contained within borders, and we've all been affected. We've unfortunately seen the elderly and the vulnerable hit particularly hard, but for children, the pandemic is extremely devastating. It's affecting their entire environment in which they develop and grow. And this starts with education. So today, we're here to talk about education and to hear from our in-house experts who will speak to how the pandemic has affected children's education around the world. They will share some unique stories about children in the communities where Plan is active and what Plan is doing to ensure that children can continue their learning and return to the classroom where it's safe to do so. I do want to say we could not do this work without all of your generous support. Thank you for your continued engagement and your loyalty to Plan Canada, and most importantly, to the children that we serve. So what I would like to do now is hand it over to our moderator today, who is Zola Ncube. Zola is one of our outstanding youth ambassadors who will kick off today's webinar. Thank you very much, and over to you, Zola.
Thank you, Lindsay. I'm so excited to be your moderator for today's session and to explore the impact to education and how Plan is working with community leaders, men, women, girls, and boys to minimize the impacts of COVID and to continue to advance children's rights. I'm no stranger to Plan International. In fact, I first got involved with Plan International Canada in 2018 as a part of the Speakers Bureau. And then from then on, I was a part of the Girls Belong Here program, which is a wonderful initiative that puts girls in leadership positions for International Day of the Girl. So I was really excited. I was placed at the United Nations, at the permanent mission of Canada to the United Nations in New York. So that was super, super cool. And then a few months later, almost a year later, I returned to the Plan International Canada office, but on the other side. So this time I was a part of supporting programming. I joined the team as a youth engagement summer associate. And as a result of my experiences with Plan International Canada and all the support and the motivation, I'm currently working on a youth social enterprise, a youth grassroots project in Cholocho, Zimbabwe, which is my birth country. And I'm also preparing to start my master's in international education policy at Stanford University in the fall. And so I'm also joined today by two very experienced experts in the field of international development and education. I have Peter Sims, who is a senior education advisor at Plan International Canada, where he supports the development and delivery of education to some of the world's most vulnerable children. He specializes in fragile and conflict settings and responses to complex and protracted crises. Angela Muriithi is the country director for Plan International Zimbabwe. Angela holds a PhD in sociology of education from the University of Cambridge, a master of philosophy in politics, democracy and education from the same university, and a Bachelor of Education degree from Kenyatta University in Kenya. She has 8 years of professional experience in senior management, specializing in designing, implementing, and monitoring and evaluating development and research projects. She's a dynamic and collaborative driven individual with a passion for social justice and for tackling the problems faced by girls and women. But before we get started today, I wanted to mention a few housekeeping points. 1, we have set aside some time at the end of this webinar for a question and answer period. If you'd like to submit a question, please locate the chat box to the right of your screen. If you submit a question or comment in the chat box, it will be sent to a private chat box that is monitored by a member of our team. If you don't see your question right away, don't worry, please only send it through one time, as these questions will be published at the end of the webinar. However, if we don't have time to get to all the questions, we will follow up via email with the questions and the responses. 2, this webinar is being recorded and we will send out the link to the recording to all registered attendees. 3, if you are arriving at this webinar past 1 p.m. Eastern Standard Time, the webinar will start from the beginning. If you'd like to watch it from the beginning, no worries, continue. But if you'd like to join us live, please click the red live button at the bottom of the screen so you can watch the webinar in real time. So let's get started. Can we get started with the big picture? How many children are out of school around the world? Peter, can you brief us?
Sure, thanks Zola. Thanks for that introduction. So at its height in about mid-April, almost 1.7 billion children were out of school across over 195 countries. That's almost 95% of the global student population. These figures are unprecedented. There's no comparison. As of today, with some countries reopening schools and then some very quickly being forced to close them again, there are still well over 1 billion children not in school. But we need to remember that before COVID hit, there were already 250 million children out of school. That's almost a quarter of the current number forced out of education because of COVID-19. So 1.7 billion may be a big number, but once the dust settles and schools start to reopen safely, the real question is how many will not go back? That figure of 250 million could rise dramatically.
Thank you, Peter, for setting the scope on what was happening to children education pre-COVID, during COVID, and then post-COVID as well. And I know that we have many child sponsors. We have many child sponsors on the call today, who I'm sure are wondering, what about our sponsored children? Angela, can you tell us more about that?
Thank you, Zola, and thank you for the introduction. So Plan International globally has about 1.3 million sponsored children across the Federation. So it's quite difficult to know how each sponsored child is doing. In Zimbabwe, for instance, we've got about 33,000 sponsored children, which includes around 6,500 with Canadian sponsors. Various countries around the world are various levels of the pandemic out of it. Some are just are at the beginning, and some countries are at the peak of it. So as a global organization, Plan International temporarily ceased sponsorship activities in March in order to contain the spread of COVID, and this included stopping the delivering and retrieving of letters, sponsor visits, etc. In recent weeks, however, some countries have resumed sponsorship. I know at the moment we have about 8 countries doing sponsorship work. And in order to resume sponsorship safely, each country has to meet an established set of criteria. For example, we have to abide by government regulations that can dictate movement. We have to make sure that our staff and community volunteers are suitably trained up and oriented on COVID-19 safety prevention measures so that they can work safely with communities. And also the communities themselves have to agree for us to get back to work with them. So each country has to present a business case saying we are now ready to resume sponsorship. Here in Zimbabwe, we intend to resume in September as soon as we are confident that we have satisfied all the conditions. And as we resume, local staff will be validating that sponsorship children are still living where they were living before in their sponsorship communities. We will be confirming if they are receiving any distance learning of any kind or if they plan to go back to school. And we will process and clear all outstanding sponsor inquiries, letters, and annual updates. And just to note really quickly that for any sponsors in the audience, please know that actually the children and families here in Zimbabwe have been asking after you, and they hope that you are well and safe. They do understand that the situation in the developed world has been very serious, and they hope that you are, being able to keep well and safe and looking after yourselves. So in terms of the situation for sponsored children here in Zimbabwe in particular, I think it remains very challenging. The country is facing a triple crisis at the moment for three main reasons. One, from the severe economic challenges that are affecting the country, and these are well documented, well known. Two, from the drought and food insecurity situation that has hit the entire Southern African region and Zimbabwe quite hard. We have about 5 million people in this country who are affected. And now we have COVID-19 in a context where the health system is on the verge of collapse. We have poorly equipped hospitals in terms of, equipment, medicine, doctors and nurses on strike quite a lot because of pay issues and lack of sufficient PPE for them to work safely. So what we have in Zimbabwe is a kind of complex, multi-layered crisis. And this is the environment that many sponsored children and families are dealing with, both in urban and rural areas in this country. In terms of education, schools have been closed since April, as in many parts of the world, and this situation is likely to continue until January. So our role as Plan International, as a country office of Plan International, is to really do our best to maintain the links with our sponsored children as best as we can, even with sponsorship activities on hold, even with movement restrictions. We do try to ensure as best as we can that our sponsored children are doing all right, that they're keeping safe from COVID. And some of the ways that we are trying to do that include quite a lot of risk communication with announcements and public discussion programs that are going out on various radio and television platforms. So far, we've reached over 8 million people in Zimbabwe, and we do make sure that our announcements are child-friendly, child-focused. We are making sure that all our emergency response projects, both for COVID-19 and for the food security situation, are reaching both sponsorship children and non-sponsored children. And through our network of sponsorship volunteers, we are encouraging sponsorship children to tune into the radio lessons, which are being provided by the government through the support of UNICEF and Plan International. There are other things we are doing, using mobile phones that I will talk about a little bit later in the webinar. So that's the general situation for sponsorship children in Zimbabwe, Zola.
Wow, it's great to hear that despite current COVID situations, lockdowns, and dynamic regulations, we are still staying up to date with our sponsored children. And as an international development organization with over 80 years of experience, what has Plan learned about assisting children who have had their education disrupted? Peter, let's start with you.
Thanks, Zola. Well, while COVID-19 might be unprecedented, there is a disturbing regularity to education being disrupted. Think again of that figure of 250 million children not in school that I mentioned before. The majority of those 250 million children are in conflict and crisis contexts, what we often call fragile states, places of cycles of war and violence, or where the effects of climate change and global heating are most felt, and where poverty or corruption are endemic, or often where there's a combination of all of those factors. These are the places that Plan International prioritizes and where we work with children every single day. These are children who are in refugee camps, who have been forced across borders where they can't access school, or they're living in the kind of abject poverty that means school is not an option. For example, Rohingya refugees in Cox's Bazar, people fleeing Boko Haram in northeastern Nigeria, Venezuelan families camped on the border in Colombia, or the children who escaped the bombs in Syria to seek sanctuary in Lebanon and who now have another crisis on their hands. But possibly the most relevant example for this current situation is the Ebola outbreak in Sierra Leone, Liberia and Guinea in 2015. Now, Plan is one of the largest charities in Sierra Leone, which itself is one of the poorest countries in the world, where few girls finish primary school and barely any finish secondary school. And yet, through the work of Plan International and our Return to Education campaign, once schools reopened in Sierra Leone, more girls enrolled than had ever enrolled before, aiming to turn that crisis into a positive situation. In that kind of crisis situation, Plan International will always consider the long-term implications and needs, building on each phase from the initial response to the longer-term recovery, and then to that transformation, taking the lessons learned from a crisis and using it to improve on what went before and to build back better. And that's what we intend to do this time with COVID-19.
Thanks, Peter. Just to pick up on what you were saying, you mentioned that the different ways in which countries are affected by humanitarian crises, and I think you mentioned environmental shocks and climate change. I think this happened to us in Southern Africa during in March 2019 when we were hit by Cyclone Idai. It hit Mozambique and parts of eastern Zimbabwe quite hard. And this was a major emergency for Zimbabwe. In fact, we are still feeling the effects of it today. Many lives were lost, and there were huge economic and social impacts felt by communities, some of whom are still going through the process of recovery. One of the sectors that was very much affected by the cyclone was that of education. I think in both countries put together, about 400,000 school children had their learning disrupted by the cyclone. And so we therefore had our hands very busy responding to this situation. Plan's response to the cyclone included setting up of temporary learning spaces and securing the provision of placement learning and teaching materials so that classes and lessons can resume as quickly as possible. We were also involved in providing safe spaces and psychosocial support for children, which is not always prioritized in situations like this. In fact, we often have to fight very hard for that space in humanitarian coordination team meetings. And we know that children and girls have particular difficulty accessing services. During the recovery phase, we've been involved in rehabilitating schools that were damaged. And finally, we've been providing teachers in schools that were affected here in Zimbabwe with disaster risk management training for teachers, which is, is quite innovative. We've never done it before. And I think the teachers and the head teachers really appreciated it. So, what did we learn at the end of it? I think we learned that crises and emergencies provide us with an opportunity to build back better, as Peter mentioned, and this is an opportunity not to be missed. There's a strange, sounding phrase, never waste a crisis. And in many ways it is true. When crises, emergencies happen, especially when dealing with the education sector, we often have a chance to rebuild education systems to standards even better than before the disaster. We have an opportunity to reform curricula, rather, improve learning methods to new standards, often during recovery and construction, and provide an opportunity to increase educational access, retention, quality, and equity. One important learning for us, just really quickly, was that whatever we do, we have to include the participation of various stakeholders, including the children and girls themselves. They know the problems they're facing. They often have the solutions. So in order to ensure effective and inclusive responses, we must include them and hear their voices. Finally, our responses should ensure that we keep working on social norms and beliefs that keep children out of school, even during emergencies, as during these times they become more pronounced. Often when girls drop out of school, I think Peter mentioned this before, because of an emergency, many tend not to come back to school. Other needs take priority. The boys end up going to school over the girls. The girls may have fallen pregnant, etc. So we must continue working with communities to ensure that the girls' education is not undermined because of an emergency. Over to you, Zola.
Thank you, Peter and Angela, for sharing lessons. It's reassuring to know that Plan has has taken the lessons learned from other situations and is applying them. And Angela, you briefly mentioned the particular vulnerabilities that girls face. And I know that Plan's mandate is to advance children's rights and equality for girls. So what are the particular vulnerabilities? Can you elaborate more on the particular vulnerabilities that girls face during a global pandemic, Angela?
Thank you, Zola. So you will recall I mentioned the many crises we are facing in Zimbabwe at the moment. And in this situation, adolescent girls, children, young people, as well as disabled persons and other vulnerable groups tend to be more adversely affected. And this is because during humanitarian emergencies of various kinds, all the kind of negative social norms and behaviors and practices that these groups would normally have experienced, in quotes, come back, strongly, much more strongly, even where we had made improvements, where things were beginning to get better. You see discriminatory practices and negative behaviors that affect girls' future chances become more prevalent, and that's why we are using quite a lot the hashtag Stop the Setback. In simple terms, during these situations, things get much worse for these groups. And so the COVID pandemic, combined with all other crises here in Zimbabwe, has really reduced girls' access to education and schooling because schools are closed. As I've mentioned, more than 5 million children in the country are affected, and girls are therefore deprived of the traditionally protective role that school plays, and they are more exposed to risks of abuse outside of school. You will have seen cases in Kenya, for instance, where thousands of girls have become pregnant in the course of the lockdown period. Being in school also increases the risk of girls getting married. We know that this negatively affects their life chances in many ways. In Zimbabwe, we have over 30% of girls marrying before they reach 18. And the truth of the matter is, unless we work very hard to ensure that learning continues for these girls and that families and communities are motivated to keep their girls learning, many of the girls out of school at the moment may never return. And this is why Plan International really places a huge importance on working in the education sector during emergencies. In Zimbabwe, the COVID-19 pandemic has also negatively impacted access to sexual reproductive health services for adolescent girls and young women. And this includes information, counseling, contraceptive services, maternal and newborn health services, amongst others. And the pandemic is also causing disruptions in meeting family planning needs because clinical staff are otherwise occupied with responding to the COVID-19 response and may not have time to provide services or may lack the protective equipment to provide the services safely. So you'll find that in addition to this, young women are refraining from visiting the health centers due to fears about COVID-19 or due to movement restrictions. Supply chain disruptions, are also limiting the availability of menstrual products and contraceptives in many places. COVID-19 has caused a lot of border closures. So all these challenges are resulting in an increased risk of girls becoming pregnant at a young age, which we know here in Zimbabwe is a driver of child marriage and increases reduces a teenage girl's life chances dramatically. And going back to schools just for a second, you should know schools in Zimbabwe have also been a source of comprehensive sexuality education. Is the confidence, of the girls in terms of their sexual reproductive health and rights, and with schools closed, they do not have access to this information. Cases of GBV and in particular sexual gender-based violence have shot up in Zimbabwe, as they have in many parts of the world, particularly during the lockdown period. We have seen huge increases in calls being made to our 116 childline number here in Zimbabwe, with the majority of calls being made by adolescent girls. and with the majority of cases involving physical and sexual abuse. So that's a huge vulnerability that the girls are facing. The pandemic is also exacerbating the food insecurity situation, which we are already struggling with. The pandemic means there is less food to go around. The informal sector has been badly affected, and therefore families and in particular girls tend to experience harmful coping mechanisms. When families run out of food, adolescent girls are often forced into risky behavior to help put food on the table. And when things get really desperate at home, child marriage becomes a painful but viable option. So just to finish, as Plan International, we are responding to all these different vulnerabilities in country. We are working really hard to ensure that the most vulnerable children and girls have access to continued learning. In fact, the other day we delivered some self-learning materials to some 160 very excited and grateful girls in Muriithi, which is some 500 kilometers away from Harare, really remote parts of the country. We're also reaching about 1,000 girls through WhatsApp learning, through mobile phones. We're distributing menstrual health products to girls, as well as strengthening referral pathways so that girls' protection needs are met. And of course, there is all the media work that I've already mentioned. So we are doing our best to respond to these vulnerabilities, Zola.
Just to build on that a little bit, Angela, thanks for those examples from Zimbabwe. To put that in a global kind of perspective, though COVID-19 may have been a global pandemic, its effects are far from consistent across the world. And as you mentioned, the risks for women and girls are significant and disproportionate. And the effects will be long-term if we don't act now. The good news is that we know what is needed. We have a solution, and that is education. Educating girls is the single most powerful tool available to us to change pretty much every facet of our society. And there's simply no denying the fact. Places where women are educated are wealthier, healthier, more peaceful, more democratic, more tolerant. Educating girls is the catalyst for changing not only gender inequalities, but societal injustices as a whole. And this is the basis for what we call a gender transformative approach. Education has phenomenal power in terms of a tool for change. Each additional year of schooling a girl has raises their lifetime earning by up to 20%. Each additional year of secondary education reduces the likelihood of marrying as a child by 5%. So every single year is significant. Now, so far, schools have been closed for almost 6 months. That's a long period of time, and that will have a colossal and a direct and an immediate impact on the wealth of girls, on their health, on their ability to avoid marrying as a child. COVID has the potential to set us back quite significantly in the fight for girls' education and gender equality. So for that reason, since the pandemic was declared, Plan has had this issue at the forefront of our minds, placing girls at the center of everything that we do. We've prioritized above all continuity of learning, ensuring that some form of education makes it through the lockdown in whatever form we can. That continuity is the most vital step in ensuring that as we move towards recovery and reopening phases, that the barriers have not become too great for girls to re-enter. Without that focus on maintaining a basis of learning and a connection to education, the impact could be massive. And that, I mean that in the millions in terms of girls not returning to school.
Thank you, Angela, and thank you, Peter, for expressing the importance of continuity. And I know I mentioned earlier about my involvement with Plan International Canada, but more specifically, my involvement as a youth engagement summer associate, as well as on the Speakers Bureau and on the Girls Belong Here program, allowed me to improve my advocacy skills, as well as empowered me to develop various leadership qualities that I didn't really think were possible. So as a result of those experiences and other experiences, I've returned to my birth country, Zimbabwe, to work on OBD Ventures, which is a youth social enterprise based in rural Zimbabwe and specifically Cholocho, Zimbabwe. And in this process, I arrived here in Zimbabwe super confused, and one of the first conversations I had was actually with the Plan International Zimbabwe staff. And I was just so excited by the inspiration and the motivation that they were willing to give me as a young person. And it was wonderful that they provided me with the information that I needed to create my own version of social change and positive change in my community. And so, Angela, I was just wondering, how are the youth voices shaping our work, and how are youth mobilizing for change?
Thank you, Zola, and it's good to hear about the work that you're doing in Cholocho. It's one of my favorite places to visit in Zimbabwe. This is a great question, because as it turns out, today is International Youth Day, and the theme of the International Youth Day 2020 is youth engagement for global action. And the push this year is to put the spotlight on youth engagement at local or community level, at national level, in terms of the formulation of laws, policies, and their implementation, and also engagement at global level. So I think it's great to hear from you what you're doing, because you seem like you are definitely engaged, Zola. With the world facing some of its most pressing problems at the moment, not to mention COVID-19. There has never been a more important time to do this, because young people, including adolescent girls and young women, have lots of energy. They have enthusiasm, optimism, and the ability to envisage a better future, which in itself is a source of strength during these very difficult times. They believe in the possibility of change and in their own ability to contribute to it, and they show a lot of resilience, imagination, leadership, and compassion. And these are the very qualities that their communities need during humanitarian emergencies. So in Zimbabwe, for instance, we've been working with young people quite a lot, who are the creative force behind a lot of our risk communication, our messaging, to the general public and to children around COVID-19 prevention measures. They have been behind creating the public service announcements that have been going out, being broadcast on various platforms here in Zimbabwe, reaching over 8 million people. And they have been advocating for issues that are important to them, such as gender-based violence, such as access to contraception, menstrual health hygiene, access to continued learning. We're also working with young people, supporting them to manufacture and sell protective equipment, to soap, hand sanitizer. And this is a means of protecting themselves and their own families, as well as generating much needed income. In other country offices, in Uganda, for instance, they are engaging with other young people on social media. They have a vibrant social media scene, creating songs and music videos that are incorporating COVID-19 messaging, as well as messaging on girls' rights and protection and safety during lockdown. And still in other countries where we work, youth are actively engaging with leaders and power holders to ensure that their unique needs and interests are considered in various government COVID-19 task forces and national action plans. So I think youth are really critical, and as I mentioned before, we really must listen to them, give them a seat at the table, and take their input seriously into account. And by this, I don't mean tokenistic gestures to young people, but genuinely involve them in the process of crafting various responses. And you will see that they end up being much more inclusive and much more effective, Zola.
Yes, meaningful youth engagement. That's my favorite thing in the world. Thank you so much for talking about that. And I know that in Canada, schools are moving online and in various places, and basically all sectors are forced to get creative for education. And Angela, can you share a creative approach that you're particularly excited about?
Yeah, thanks, Zola. I have so many examples. It was a bit hard to choose, but maybe the one I'll talk about during the webinar is the fact that we have very recently launched our first mobile academy here in Zimbabwe, where we are working with a partner, an organization called Viamo, to train 1,400 sponsorship volunteers. Now, these are the volunteers who are kind of our interface between ourselves and the communities in some cases. And these sponsorship volunteers are being trained on COVID-19 risk communication and messaging, as well as other information on the secondary impacts of COVID-19, such as the increased risk of, child protection issues arising, gender-based violence, sexual reproductive health. And they are going through a 12-module training program using mobile phones. They receive a call and they get trained up in a language that they understand. And during the training, the volunteers can text questions, they can call back and get responses on areas that they didn't quite understand. And these volunteers will then cascade the learning that they have to sponsorship families and communities. So they act all in a sense as, our frontline workers in communities that we may not be able to reach right now due to COVID-19 movement restrictions. So this is just one example of something that we're doing here in Zimbabwe. We think it's innovative. It's not been done before by us. And we're really excited and hopeful that it will be successful, because we think it can be applied, especially in a post-COVID-19 world. It can be applied in various other humanitarian emergencies as well as our development work as well. So I think that's one example that I can give from Zimbabwe.
Wow, a mobile academy with over 1,000 volunteers. I'm so excited. That sounds so wonderful, Angela. And Peter, can you end today's discussion by sharing one example from around the Plan Federation?
Thanks, Zola. Yeah, it's certainly difficult to pick one example, considering there's been such a large scale and such a creative set of responses across the Plan's countries. How to maintain that continuity of education that I was talking about earlier when schools are closed has been extremely difficult. We know the difficulty so many kids here in Canada have faced accessing learning online. But to put that in a bigger picture, globally, only about 50% of children even have access to a computer. In Africa and sub-Saharan Africa, that number drops immediately to 10%. In the places where we work, it's practically zero. That means we had to get creative with how we reach the children that we support. One way is radio. Right now, across the world, the single largest method being used for education is the radio. In almost every country we work in, we are providing radio schooling, along with partners, working with the government, working with ministries. Radio schooling has been the fastest and it's the most equitable method of reaching people. But we also use others. TV is another method that we've used. It's particularly effective in some urban areas. And that's been, again, a vital source even here in Canada. In other places, we've used SMX text messages as a way to maintain contact with parents, community leaders and teachers. Sometimes that's about providing messages about education, providing new materials for parents to support. Sometimes it's just about maintaining a connection with their school, with their teacher. Our priority in terms of continuity of education, though, is not simply about maintaining traditional learning, about mathematics or literacy or something. Of key concern right now is what we call psychosocial support. This means the well-being of children, their psychological and emotional health, and their ability to maintain positive relationships. Something that we maybe didn't predict and could never have realized would be as vital an issue as it is. This has led Plan to develop some new partnerships with some exciting organizations. Ones that people might have heard of here include Sesame Street and Lego. Both of these organizations have a wealth of knowledge about play therapy from years and decades of supporting children in places like the UK and in Canada and America, and are now adapting those methods with Plan to humanitarian contexts or to COVID-19 or to places where resources are very, very few. And that's been some really exciting work. However, we've also done some of the absolute basics, a bit like Angela was saying. We've delivered thousands of home learning kits and printed materials for families. Just last week, I was speaking to a colleague in Burkina Faso, and we have printed, again, literally tens of thousands of new books and materials to get out to students immediately. It requires sometimes a combination of all of these responses to make sure that we reach everyone who needs it and everybody has something. But it also means using the tools of education for other benefits as well. And as an example of this, teachers are usually well distributed among communities, and they're a trusted source of information and guidance, trained in providing you information. This makes them a fantastic resource for health messaging. So in terms of providing information about hand washing, usage of PPE, combating misinformation, this is a vital learning that we took from the Ebola crisis, using teachers, using them as a resource for health promotion. But one thing is very clear: while COVID has shown us that things like digital learning or distance learning has enormous potential, unless it's delivered equitably, it could be hugely damaging. We need to be very careful that we don't simply design education for those with a high-speed internet connection. No form of digital learning, whatever your download speed, can replace a well-trained teacher in a well-resourced classroom.
And can I just add something, Peter, to your analysis? I think one of the things that we are really doing quite a lot of here in Zimbabwe is working very hard on families and communities' social norms, because these become when communities are faced with difficulties and emergencies, they tend to revert to default, so to speak. So a lot of the improvements that we had over the course of our time working on development in education can be lost. So it's really critical as well that we keep talking to moms and dads and families and communities about the importance of education for girls and other vulnerable groups, because it can very easily fall by the wayside. So that's one thing that we're also doing quite a lot of, just to keep reminding parents that, look, make sure your daughter is accessing, she's listening to the radio lessons, is trying to access any text or WhatsApp learning that is going on, whatever. If there are community volunteers teaching, please make sure your girls are continuing to access learning and or schooling in any way, shape or form, so that we don't end up losing a whole raft of girls who are in school after COVID-19 because other things have come up. I think the social norms is really critical. It's one of the things that we are working quite a lot on here in Zimbabwe, Peter.
Thank you, Peter, for sharing how there's a range of various interventions, but they're all very impactful. And then thank you, Angela, for your addition in the importance of tackling social norms during this time and all the time, really. So at this time, I invite the audience to bring in the questions because we're going to do our Q&A session now. And don't worry if we don't get to your question, we will respond via email to any questions that aren't addressed today. So Peter, we have one question here. Can you share something you think will be a positive change that comes as a result of this pandemic?
I think, yes, I think this, and we talked a bit about this in terms of transformation, learning from crisis, making use of it, trying new things out, trying new creative methods. And I think that's going to be very important. We've learned that solutions particularly cannot always be provided by governments. That's something we've learned in a lot of countries. We can't always wait for the government or the state or the ministry in question to provide every resource. There needs to be a responsibility that we take for our own learning, and that goes for families and communities, and also recognizing that they are a huge resource in this kind of response. We need to remember that the foundations of education are not solely held in the bricks and mortar of a school or in the policies and priorities of a Ministry of Education. They are in the communities and in the families and in the individuals and in their resilience to these kind of crises. And I think resilience is the word that I would like people to remember. And I think education systems have a big part to play in building that resilience and making sure that we are able to cope with and respond to and adapt to crisis and shock when it happens, because we may not be able to know when it will happen, another COVID-19 or something else, but unfortunately we may have to be ready for it. I think also we need to expand the definition of the right to education. This is a specific point about digital learning. We need to include connectivity in that definition of the right to education, and to start to reduce the staggering inequality that we have about who can and who cannot access the internet. If we don't do that, it has the potential, education has that potential to be inverted from that tool for positive social change to simply be a mechanism for expanding inequality. So there are good things that we've learned, and then there are additional risks that these opportunities do provide. But I think I'm optimistic. I think that there's a creativity out there, and we just need to find ways to make use of it.
Wow, thank you so much for, I think one thing that really caught me was the idea of resilience and the importance of education systems in building resilience. And Angela, speaking about resilience, is Plan doing any work? We have a question here from our audience. This is the question. Is Plan doing any work or training in Zimbabwe directly with teachers or the teachers union while classes are suspended?
Yeah, thanks, Zola, for that question. We are not working directly with teachers or the teachers unions themselves. This tends to be quite a sensitive area here in Zimbabwe. You know, the issue of working in the education sector with the unions, and this is because they generally tend to be quite confrontational. They take up a confrontational approach. We do work with them as part of something called the Education Coalition of Zimbabwe, where we are members, and that's where we have quite a lot of our interaction with them. So far, what we have done in terms of contributing to continued learning here in Zimbabwe, just working with the Ministry of Education and UNICEF, is that we have been able to provide a whole set of curricula for grades 1 up to 3. Our radio lessons going on at the moment are cover grades 4 to 8, which is where the Ministry of Education and the government were prepared. You know, they had the curricula, but they didn't necessarily have the curricula for grades 1 to 3 in form of kind of accelerated learning. And because we are running a big kind of flagship education project here in Zimbabwe, where we are trying to reach over 20,000 girls with a form of accelerated learning. And these are girls who've never accessed education at all or have very little education. We have been able to use our materials, which we developed in collaboration with the Open University, for the purpose, grades 1 to 3, and to offer them to the Ministry of Education and say, look, you can use this accelerated learning curricula for your grades 1 to 3 radio lessons. And at the moment, we're in discussions with the Ministry of Education with regard to getting this on air. And this is a really exciting thing for us. It took a lot of convincing and lobbying and influencing, because education is a sensitive issue to most governments. Education is a very value-laden thing, and they don't just hand it out willy-nilly to anyone. So I think it's a coup for us in the way that we have been able to offer this to the government, and they've accepted it. We're doing quite a lot of training with community volunteers. So apart from reaching children through radio lessons and through WhatsApp learning, we are also training quite a lot of community volunteers on accelerated learning. I think at the moment we have about 900 community volunteers that have been trained both on accelerated learning, but also COVID-19 prevention measures. And these are the people within the communities who are able to gather children together and say, I know you're not in school, but let's do some learning today. Let's read a book, let's read a story, let's do some writing, let's do some maths. And we are training these community volunteers in order that learning continues in some way, shape, or form. And this is some of the work that we are doing in Zimbabwe, as opposed to working directly with the teachers or the unions, Zola.
Thank you, Angela. I love how Plan International Zimbabwe is effectively collaborating with the government to still continue that education despite the crisis. And we have another question here. It was mentioned that Plan International Canada wants to include the voices of children and girls in the process of recovery. Just curious, in what way we actually have those important conversations and then apply that feedback? Peter, can you take this question, please?
Sure, I can speak briefly, and then I'm sure Angela can add in some as well. This is an absolute priority for us. Again, we place girls and children at the centre of everything that we do, and including their voice and empowering them to make sure that they are active in the decisions that are made about them is vital. So we have a range of processes that we go through in COVID-19 or at any other moment to make sure that we listen and we use our youth advocates, for example, like you, Zola, to connect with the communities in question, to capture their voices, to run consultation sessions, and then to provide that back into the design of any activity that we do. It's vital to making sure we're not missing anybody out, principally. So it's at the core of pretty much everything we do. We also do that then throughout the delivery of any activity. We then make sure that we do it in the analysis when we go and monitor to see what happened. We make sure that we include children in that discussion so that we know what they thought about this. Did it actually reach them? Did they feel the impact? Was it positive? Was there anything that we didn't expect? All of those kind of things are vital, and it's very interesting sometimes to hear the perspective of children, because it's easy as adults to miss something, to not fully understand it, to not realize that there's a depth of knowledge and understanding that needs to be tapped into, and builds better programming when we do.
Yeah, thanks, Peter. I think this is we work in quite a similar way in terms of how we try to design our projects. We try and make sure that the projects are responsive to the needs of young people and adolescent girls by getting their viewpoints, their inputs. We spoke quite a lot of them when we were developing our country strategy, for instance, just making sure we are not, digressing, and we are still serving them as they are our major constituents. One thing we do really well, I think, country offices, at least here in Zimbabwe, is we try to get young people, and as particularly adolescent girls, together with decision makers and power holders. So we get them around the table and we get them talking. We had a very successful, this is pre-COVID, however, just before pre-COVID, I think a month before, I think it was in February maybe, where we had a girls' symposium. So we gathered girls from across the country, brought them into a kind of, a camp where they had lots of discussions, training, but also more importantly, we were able to bring them together with members of parliament from Zimbabwe, and the girls were able to talk about some of the challenges they're facing around, access to menstrual health products, for instance, which are extremely expensive here in Zimbabwe. They are like a luxury item. And the girls really advocated strongly for themselves that the government make these free, that they provide them in schools, that, this is the impact that it's having on them as girls. They are missing out on schools, they can't afford it, there's the stigma, there's the psychological impact, etc. They were able to speak for themselves, and it was really, just amazing watching them interact with members of parliament, and power holders tend to be very convicted when they hear for themselves from the mouths of young people. So I think country offices from all over, the plan world, so to speak, I think we're very good at this. Convening, we are a powerful convener, and we can bring together young people, adolescent girls with power holders and decision makers so that they can speak for themselves. Zola.
Thank you, Peter and Angela. I'm so excited. Those are wonderful, wonderful responses to our viewers' questions. And we just have one more question before we run out of time. Peter, if you could quickly get this question, what is the best way for Canadians to help?
The best thing they can do is visit the website, visit Plan Canada's website, learn more about what we're doing, engage with what we're doing, donate if you can, and educate yourselves as well about the issues and the priorities in question. Listen to our social media. We provide as much as we can information about what we're doing, why we're doing, how we're doing it, and why it's important. So yes, please stay in close contact. Go to the website, follow our campaign about stopping the setback, and yes, do donate if you can.
So unfortunately, we have run out of time for more questions, but rest assured, other questions will be responses to the other questions will be sent via email. And I will now ask Lindsay to share some parting comments.
Thank you very much, Zola, for both moderating today's webinar and your incredible dedication to our work and the mission here at Plan International Canada. With people like you leading the charge for social change towards a more equitable world, I feel very confident and inspired in what the future holds for all of us. And Peter and Angela, incredible, your expertise and your stories just have been so informative and thought-provoking. Your insights have certainly helped us better understand how COVID-19 is affecting children around the world, and also the multi-layered nature of the crisis. You both also spoke very eloquently to the power of education, so thank you. We also heard from Angela about the situation in Zimbabwe, just having, I think, the really specific country examples were super helpful. But we learned about COVID-19 and how it's setting us back in just so many ways, but especially for girls in crisis. It's just done so much more in setting them back and is unraveling decades of progress and keeping girls from the rights we've worked so hard for up to now. So that's why you've heard it referenced a few times. You've seen, I don't know what I'm pointing to, but our backdrops. We have a global campaign called Stop the Setback. And the campaign Stop the Setback is really about raising awareness about the challenges that we've spoken to today, specifically the challenges of girls in crisis and what they're currently facing, and the ground that we're losing on the gains that we've made over the years for children and especially for girls around the world. So Peter has already talked about how you can contribute, but perhaps I will just re-emphasize, of course, donations are always welcome, but more importantly, just helping us spread the word through your social accounts, your personal networks, and if you're technologically inclined, you can always actually download these different backdrops that we have on our website. They all have Stop the Setback. There are a few different settings, and just even putting that up on your Zoom or your social media backdrops is incredibly helpful. It just provokes some conversations, some questions, and helps amplify the message about the situation that girls are in globally. So I encourage you to visit our website. There's a very, very clear description on how you can download the backdrops, and you can also learn more about the campaign. So thank you once again for joining today. Thank you to our moderators, our participants. Please keep an eye out for any future emails from our philanthropy team, because we do, as long as we're in this situation, continue to hold these sessions. So I think that's it. Have a great afternoon, and thanks once again for all of your support.